This skill may be performed either with and/or without the gum elastic bougie device. Make sure that the patient is receiving adequate ventilation and oxygenation, and that suctioning equipment is immediately available in case the patient vomits or has excessive secretions. First, ensure proper sterilization. Closely inspect the endotracheal tube for proper sterilization, visible damage, internal blockage, or loose particles, and test the balloon for leakage by inflating and deflating the cuff with a syringe. Connect the laryngoscope blade to the handle and check that the light bulb is securely attached and functional. Assess the patient's airway for ease of intubation using the lemon mnemonic. Do not hyperextend or hyperflex the neck during the procedure. Hold the laryngoscope in your left hand. Insert the laryngoscope blade into the right side of the patient's mouth, displacing the tongue upward and to the patient's left. Please note that this only applies to a Mac blade and not a Miller. Visually identify the epiglottis and then the vocal cords. External laryngeal manipulation with backward, upward, and rightward pressure may be helpful for better visualization. Under direct vision, gently insert the endotracheal tube into the trachea without applying pressure on the teeth or oral tissues. Inflate the cuff with enough air to provide an adequate seal, but don't overinflate it. A variety of techniques can be utilized to confirm that the endotracheal tube has been correctly placed in the airway. If endotracheal intubation is not successfully accomplished within seconds, or in the same time it takes to hold your breath before exhaling, discontinue attempts, apply ventilation with a bag mask device, try again using a gum elastic bougie, or seek assistance from another qualified provider. When you have ensured correct tube placement, secure the tube. If the patient needs to be moved, tube placement needs to be reassessed. Finally, attach a pulse oximeter to one of the patient's fingers to measure and monitor the patient's oxygen saturation levels and to provide an immediate assessment of therapeutic interventions.